You've brought us some info on Coates disease. It's this rare eye condition, and it sounds like you're really hoping to understand it better, like what to look for, how it's treated, all that. So let's dive in.
Yeah, you've come to the right place. It's definitely complex, but we can break it down.
It seems like it usually affects just one eye and mostly young boys, but it can happen at any age.
That's right. Most common in boys, yeah, but anyone can develop it. And that's actually what makes it so important to understand, right? Because it's less common. It can be missed if, well, if parents and even doctors aren't really familiar with it.
That makes sense. So what's actually happening in the eye with this? What's causing the vision problems?
So it all starts with the blood vessels in the retina. Think of the retina like the film in an old camera. It's that thin layer at the back of the eye that captures the light and sends signals to the brain so we can see.
So it's really critical for processing images.
Exactly. Now, with Coates disease, the blood vessels that are supposed to supply the retina, they don't develop properly. They get dilated, all twisted, weak. And because they're so fragile, they start to leak fluid.
Oh, I see.
Yeah. Imagine like a garden hose with tiny holes.
Oh.
Instead of watering the plants directly, all that water just spills out and it starts causing damage.
So these, what did you call them? Leaky blood vessels. Those are what damage the retina.
Exactly. The fluid builds up, and it can actually make the retina detach from the back of the eye. So like imagine wallpaper peeling off a wall. It really compromises the whole structure.
And that's bad news, obviously.
Definitely. When the retina is compromised, and remember, it's responsible for sending those visual signals, vision gets impaired.
That's a really clear analogy. So if these leaky blood vessels are the root of the problem, are there any early warning signs? Anything that someone might notice? That leaking and detaching, that sounds really worrisome. So are there any warning signs for this, like things that parents or even adults should watch out for?
You know, that's such a good question. See, early diagnosis is really the key here, because those early stages, they might not even have any noticeable symptoms.
Oh, wow.
Yeah, that's why those regular eye exams, and I mean comprehensive ones with dilation, those are so important, especially for young kids.
So those regular checkups, those are the first line of defense. But are there any red flags, something someone might notice at home, even if they're getting those exams?
Yeah, absolutely. Some things you can definitely notice yourself, although some signs you really need an eye doctor to see them. But one of the most common ones is decreased visual acuity. It might be subtle, like almost like you're looking through a dirty window at first,
Right, right.
but it's important to pay attention to any changes in vision, really.
Yeah, for sure. Any other visual changes besides that, I mean?
Let me think. Oh, yeah, there's one called leukocoria. Basically, it's a white pupil reflection. You'll really notice it in photos where one eye reflects light differently.
So if you see that white glow in one eye in a photo, that's a sign to get it checked out.
Yeah.
Exactly. I mean, it might be nothing, but it's always better to be safe than sorry, right? Another one is strabismus. So that's where one eye seems to kind of wander, turn inward or outward.
Ah,
Again, these signs, they could be from other things too, but they definitely mean you need to see the eye doctor.
right. So any unusual eye movements, anything weird, get it checked out, makes sense. You mentioned earlier that this progresses in stages, right? Can you kind of walk us through that? Like, how does the condition actually develop?
Absolutely. So think of it this way. 5 main stages. Stage 1, it's like that garden hose we talked about. There might be those weak spots, those abnormal blood vessels, but they're not actually leaking yet.
Okay.
This is where those regular exams are so important because if you catch it here,
You can really get ahead of it.
you got it. Now, in stages 2A and 2B, that's when those leaks start. First, the fluid builds up outside the fovea. That's the very center of the retina. It's what gives us our sharpest vision. Then, in 2B, it starts affecting the fovea itself.
And that's when the vision problems get really noticeable, I'm guessing.
Yeah, unfortunately. Then we move into stages 3A and 3B, and this is where we see partial and then total retinal detachment. Remember that wallpaper peeling off.
Uh-huh.
This is where vision is really affected, and we usually need to intervene more immediately.
So stages 3A and 3B, those are a real turning point in how serious it is.
Yeah, I think that's a good way to put it. And if it progresses to stages 4 and 5, well, that's when you see those more severe complications, like glaucoma. That's increased pressure in the eye, and eventually in that final stage, the eye just can't function like it should anymore.
Wow, those later stages sound really scary. But let's talk about treatment. What can be done, if someone's diagnosed with Coates, hopefully early on?
Yeah, that's the good news, right? There have been some amazing advances in treatment. What we do really depends on the stage, of course. Like, In those early stages, we might just monitor it for a bit. And if there are leaks, but they're small, we can use laser therapy to seal them up.
So it's like using a tiny laser to kind of cauterize those holes in the hose we were talking about.
Exactly. Yeah, it's very precise. Now, for the more advanced cases, if there's retinal detachment, surgery might be necessary. There are a few different ways to do it. Like sometimes we can actually reattach the retina. And there's also cryotherapy, which uses extreme cold to seal the vessels.
It's incredible how advanced all this is. So we've talked a lot about how it works, but what about the underlying cause? We know it's more common in boys, but anything else that puts someone at higher risk?
Ah, the million-dollar question. Honestly, researchers are still working on that one. There's no clear genetic link. It doesn't seem to be directly inherited. But a lot of people with coats also have this mutation in a gene called the NDP gene,
NDP, what's that stand for?
Nori disease protein. And this gene, it's really important for blood vessel development, particularly in the eyes. So we're still figuring out the exact connection, but this gene mutation, it could be a big part of the puzzle.
So research is ongoing. That's good to hear. But for our listeners, especially anyone worried about their kids or even themselves, what's the most important takeaway from all this?
I think it boils down to being proactive. Regular eye exams, I can't stress that enough. For everyone, but especially young boys, those early checkups, they are so crucial because the earlier you catch coats, the better the chances of protecting vision.
Early detection is key, for sure. We've heard that throughout this whole deep dive.
It's true. And with all the advancements in treatment, a coats diagnosis, it's not the end of the world like it might have been years ago.
That is really reassuring to hear. Well, this has been an incredibly informative deep dive. We've learned so much from those leaky blood vessels to early diagnosis and even the latest treatments.
It's been a pleasure. I'm glad we could do this.
And to our listeners, we hope this has been helpful and empowering. Remember, knowledge is power, and you can use this to really advocate for your own health and the health of your loved ones. If you have any concerns, please reach out to your eye doctor. And on that note, we'll leave you with a final thought. While we've talked about what we do know about coats, there's still this big question. If it's not purely genetic, then what else is going on? What are the environmental or other factors that might trigger it? It's something researchers are actively looking into, and it reminds us just how much we still have to learn about the complexities of us. Until next time, stay curious and keep those eyes healthy.